हैव यू एवर वॉन्डर्ड सर्जरी के टाइम डॉक्टर आपको कैसे एकदम डीप स्लीप में ले जाते हैं? वेल, दैट्स नॉट मैजिक, इट्स प्योर साइंस ऑफ जनरल एनेस्थेशिया. हेलो डियर फार्मासिस्ट एंड मेडिकल स्टूडेंट्स, वेलकम बैक टू ए न्यू वीडियो. और आज की वीडियो में विल बी डिस्कसिंग अबाउट द मैकेनिज्म ऑफ एक्शन ऑफ जनरल एनेस्थेटिक्स. लास्ट वीडियो में वी सॉ व्हाट आर जनरल एनेस्थेटिक्स, व्हाट आर देयर स्टेजेस, व्हाट आर देयर क्लासिफिकेशंस, हाउ दे वर्क. Now we will see how their mechanism of action occurs, like how they actually work inside the body by working in different sites. Okay, so first of all I would like to state two things, that our body works in two directions. One is excitatory, second one is inhibitory actions. Okay, now first of all, general anesthetics mainly act in the central nervous system, okay, that is your brain and spinal cord, but they work by modulating ion channels and neurotransmitter system. Okay, as I said, our body will be having two types of signals in the brain. First one is excitatory. Okay, in excitatory signals, जैसे क्या होता है ना, हमारे बॉडी में जैसे एक्सेलरेटर दबा देते हैं बाइक में या फिर गाड़ी में, ऐसा होता है, मतलब making our brain more active. Okay, next we are having inhibitory neurotransmitter और neurotransmitter बोल दिया, inhibitory signals, जिससे कि समझ लीजिए गाड़ी को ब्रेक लगाना, उससे क्या होता है, it will be calming down our brain. Okay, now anesthetics basically reduce excitation and enhance inhibition. Okay, that means pressing the brake harder and slowing down the brain activity and producing unconsciousness. Okay, now how they work, they will be working mainly by three mechanism of actions. First one is potentiation of GABA A receptor. Okay, let's talk about this thing. Okay, it is very general, and most of the anesthetics like propofol, thiopentone, midazolam, etc. here will be work by through this mechanism only. Okay, now what is GABA, what are GABA A receptors, what are these things? Now GABA is nothing but is a inhibitory neurotransmitter in our body. ओके, न्यूरोट्रांसमीटर्स मतलब सिंपल वर्ड में समझिए, न्यूरोट्रांसमीटर मतलब केमिकल. ओके, एंड गाबा ए इज़ वन टाइप ऑफ रिसेप्टर वेयर द neurotransmitter will be getting bind. Okay, now GABA is the brain's main inhibitory neurotransmitter. Okay, GABA A receptors are the ligand gated chloride channels. Okay, now when GABA will be binded to the GABA will be binding to the GABA A receptor, the chloride channels will be open. Okay, and chloride ions will be flowing inside the cell, and that will be causing hyperpolarization. Hyperpolarization means the cell inside will be becoming more negative, and in hyperpolarization condition, action potential generation becomes difficult for that particular cell, and so the brain or the particular cell where the central where the general anesthetics is working will be calming down. That means our brain will be calming down. Okay, now if we see how detail work they actually functions or show, it will be like propofol and etomidate will be increasing the chloride channel conductance, chloride ion conductance by prolonging channel opening. मतलब they will be opening the channel for long time so that chloride ions can get inside for more time. And barbiturates like thiopentane at high doses can directly open the channel. They don't even need GABA chemical or something. Okay, and benzodiazepines like midazolam, they will be increasing the frequency of channel opening, means they will be opening the channel in very less time, but again and again, so that more ion will be coming inside the cell and making the cell more negative. Right, now not all the chemicals will be not all the general. Acha, before that I'll be explaining it in a short. How happens means, general anesthetics, if it is given, it will be enhancing the effect of GABA, and GABA will be going to GABA A receptor and bind to it. When binded, they will be opening the chloride channel, and chloride will be getting inside the cell. That means chloride influx will be seen, and so it will be causing hyperpolarization, and in hyperpolarization condition the cell activity will be decreased. That's it. Okay, next, not all the general anesthetics will be working through GABA A receptor only. Some will be working through the NMDA receptor, okay, like drugs like ketamine and nitrous oxide are non-competitive antagonists of NMDA receptor. Okay, normally NMDA receptors mediate excitatory neurotransmitter via glutamate. Okay, now what is glutamate? Glutamate is the body's main excitatory neurotransmitter. Okay, when these NMDA receptors are activated, they allow what? Calcium and sodium ion inside or influx in the cell. Okay, so stronger excitatory signaling will be seen as the positive ions are getting inside the cell. Okay, so depolarization will be seen, and so the cell will become more active, right? But ketamine and nitrous oxide block the PCP site inside the cell. Okay, that is the main site of action, and ion entry stops. Matlab positive ions will be stopped entering the cell, and so it will be becoming polarized in nature, and so an excitatory signaling will be diminished. Okay, now what will happen? Clinical effect. Clinical effect में we will see कि dissociative anesthesia, especially ketamine. Okay, patients appear awake but disconnected from the surroundings. Okay, and potent analgesia also will be seen, like stay strong pain relief, और amnesia भी हमको देखने को मिलेगा, मतलब loss of memory. Next is activation of 2-pore domain potassium channels. Okay, volatile agents like isoflurane, sevoflurane, desflurane opens K2P channels. Okay, those are TRK1 and TARX3. Okay, potassium ions will be flowing inside the neuron, flowing out of the neuron, and that will be causing hyperpolarization. Suppose this is the inside of the cell, potassium ion is already there, but when this channel gets activated, this will be opening the channel and potassium ion will be getting outside of the cell, and this part will be becoming negative in nature, right? That means inhibitory action will be seen. Okay, neuron becomes less excitable, less change of firing signals, and overall depression of the brain activity. Got it? Next, these were the main mechanism of actions. Now we'll be seeing other molecular effects. Suppose these were the main 3 pathways by which general anesthetics will be working, but along with those 3, these are 3 more pathways through which they will be working. Okay, we will be understanding this. First one is sodium channel inhibition. That means halothane, propofol, barbiturates may inhibit voltage gated sodium channel, and they will be suppressing the action potential. Okay, Hessian channel inhibition में क्या होता है? Propofol हाइपरपोलराइजेशन एक्टिवेटेड साइक्लिक न्यूक्लियोटाइड गेटेड चैनल्स, मतलब हिस्सियन चैनल को इनहिबिट कर देता है, उससे फर्दर डिप्रेशन ऑफ एरोजल सिस्टम विल बी सीन. चलो, दिस वेयर द particular mechanism of action, side mechanism of action. They are not seen primarily, but they will be also taken place in the body to show general anesthetics action. Okay, now as we have understand the mechanism of action, now let's see the potency of the general anesthetics we use. Okay. Now potency means the strength. Okay, the strength of a drug in some given concentrations, मतलब कि कितना कम या फिर कितना ज़्यादा अमाउंट देना पड़ता है एक ड्रग का उसका इफेक्ट शो करने के लिए. ओके, नाउ इन दिस स्लाइड इफ़ यू सी दिस साइड, इफ़ यू गो इट इज़ weaker, and this side if you go the potency is strong. That means the concentration will be required less, but the working efficiency will be more. Okay, if we start with the nitrous oxide, we'll be seeing it is the weakest. Okay, but it has the excellent analgesia effect. Okay, next sevoflurane, if we see, it is having rapid onset and minimal airway irritation, and well tolerated by kids as well. Okay, sevoflurane. Next, isoflurane is moderate kinetics and causes vasodilation. Okay, हेलोथेन क्या करता है? स्लो ऑनसेट दिखाएगा, रिकवरी भी अच्छा करेगा, बट रिस्क ऑफ हेपाटोटॉक्सिसिटी विल बी देयर, मतलब लिवर के ऊपर साइड इफेक्ट ज़्यादा रहता है. ओके, लास्ट डेस्फ्लोरेन, इट इज़ द फर्स्टेस्ट ऑनसेट एंड ऑफसेट विल बी सीन. दैट मीन्स जल्दी एक्शन भी दिखाएगा और रिकवरी भी बहुत जल्दी हो जाएगा. ठीक है, बट इट कैन ऑल्सो इरिटेट द एयरवे. Okay, so these were the drugs with their potency. Next, let's talk about the adverse effects of anesthetics. Adverse effect matlab the unwanted effects that we don't want, but it comes along with the main function of the drug. Okay, Anesthetics are life saving, but they can also have important side effects. First one is respiratory depression. एनेस्थेशिया का काम है पेशेंट्स को पेन फ्री और अनकॉन्शियसनेस बनाना ड्यूरिंग सर्जरी, बट साथ ही ये ड्रग्स के कुछ इंपॉर्टेंट एडवर्स इफेक्ट्स भी होते हैं जो डॉक्टर को ध्यान में रखना चाहिए. ओके, दीज आर सम ऑफ दोज. लेट्स टॉक अबाउट देम. ओके, सपोज फर्स्ट वन इज़ रेस्पिरेटरी डिप्रेशन, कॉमन विथ आईवी एजेंट्स. मतलब पेशेंट्स की ब्रीदिंग स्लो या डिफ़िकल्ट हो जाती है और सो वेंटिलेटरी सपोर्ट्स इनमें दिया जाता है. ठीक है, 90% ऑफ द केसेस इफ द पर्सन इज अंडर एनेस्थेसिया ही विल बी गिवन वेंटिलेशन, ही विल बी केप्ट अंडर वेंटिलेशन. नेक्स्ट इज कार्डियोवास्कुलर डिप्रेशन. इसमें क्या होता है, especially it will be seen with propofol or thiopentin. Okay, they reduces the heart function leading to low blood pressure and cardiac issues. नेक्स्ट इफ़ वी टॉक, इट इज़ पोस्ट ऑपरेटिव नोजिया एंड वॉमिटिंग. ये तो बहुत ही कॉमन है. इसमें क्या होता है, आफ्टर द सर्जरी इज कम्प्लीटेड ऑल्सो ना, द पेशेंट विल बी फीलिंग ए सेंसेशन ऑफ वॉमिटिंग एंड इट इज़ वेरी कॉमन विथ इनहेल्ड एजेंट्स. ओके, नेक्स्ट इज मेलिग्नेंट हाइपरथर्मिया, दैट इज़ अचानक से बॉडी का टेम्परेचर बहुत ज़्यादा बढ़ जाना. ओके, इट इज़ वेरी रेयर एंड डेंजरस एज वेल एंड इमरजेंसी में ट्रीट किया जाता है विथ डेंट्रोलिन. अगर ये कंडीशन बहुत बढ़ जाता है, डेंट्रोलिन के साथ हम पेशेंट को ट्रीट करते हैं. नेक्स्ट इज हेपाटोटॉक्सिसिटी. मतलब इट इज़ ऑल्सो सीन स्पेशली विथ रिपीटेड हेलोथिन यूज एंड इट कैन यूज द इट कैन डैमेज द लिवर वेरी इफेक्टिवली. नेक्स्ट, नेफ्रोटॉक्सिसिटी. सेवोफ्लोरिन के फ्लोराइड आयंस किडनी फंक्शंस को अफेक्ट कर सकते हैं. ओके, दो इट इज़ वेरी रेयर. नेक्स्ट इज इमरजेंस फेनोमेना. हियर क्या होता है, स्पेशली विथ केटामाइन इट इज सीन. पेशेंट्स में एक्सपीरियंस हेलुसिनेशंस, डिलीरियम या डिसोरिएंटेशंस जब वो एनेस्थेशिया से बाहर आते हैं. ओके, सो इन शॉर्ट, व्हाइल एनेस्थेशिया आर लाइफ सेविंग in surgery, doctors must carefully balance their benefits versus side effects and monitor patients closely. Okay, now so in this video we understood the mechanism of action, the adverse effect, the potency of the general anesthetics. And if you don't have the brief idea about general anesthetics, I suggest you to see the first video in my channel and then come to this video, so you will be getting a clear idea about general anesthetics. And thank you for watching till last.